Adam, it's great to have you, and you now run a company where you offer training on mental health to organizations, and you have a really cool story about how you started this company. But I would love to ask you a question that I ask a lot of my guests, which is, what's your relationship like with your anxiety right now?
It's real deep and it's real aware. For me, my mental illness, I, I've I haven't come to accept that it's just a chronic illness I'm always going to have to deal with.
Hmm.
I've just been willing to I'm okay if that's the case. And so
Hmm.
I wake up every day, and in spite of all of the good self-care that I do and doing work that I love, I have to check myself every day for anxiety and depression.
Hmm.
And I would say I don't, I'm about a 70% good day. I can tell by the way it's hard to breathe. And it's not uh, because of this phone call, because of my work. I don't know what it really is this morning that's making me feel a little anxious, but I'm going to work through it today. And so what I do, it's like I have Crohn's disease, intestinal disease. I work through that every day. Let's work through this every day.
Do you have any sort of go-tos that you do to work through it?
First, I breathe.
Hmm.
I have a list. Oh, it's in my briefcase on the other side of the kitchen. Oy vey. I have a list of things that I look at and I try to do every day. Right. I wrote it down on a piece of paper once when I was skiing in Whistler in Winter Park, Colorado, and it has a list of things like I need to call my friends every day, talk with one of my sisters, um, get my shit done at work, be a good dad. I need to do a little yoga,
Hmm.
have and somehow make a golf movement. Now it can be in an airport and I just pretend I'm making a golf. If I do those things every day, that's like my self-care list. But then I also have, and if I do those things every day, it doesn't mean that I'll have a great day.
Yeah.
Way more likely. And it was as a senior leader at Kaiser Permanente in the Northwest, learning what my self-care needs were was perhaps one of the single greatest tactics and levers that helped improve my performance as an executive because my problem was I wasn't taking care of myself. Anyway, so I have another list that says if I wake up and if I'm not feeling well, what do I do? Right. So I got the list of what I can do every day. And I got the list of what I got to do if I'm not feeling good. So I look at that list. You know what it says the first thing on the list?
What?
Have you done stuff from listening
Have
to
you done that? That's funny.
and 95% of the time I haven't.
Yeah.
So I just go do the stuff on the list and I exercise, I do yoga, I talk with my kids, I moved to Atlanta to start this business. So I make sure I pick up the phone and I call a good friend or one of my sisters and I focus on my work.
I focus on my work too. It really pulls me out a lot of times.
Doesn't. When you do what you love,
Mhm.
work is, I used to have one of my dad's old buddies, this guy named Ronnie Weinstein. He used to tell me, I used to go sit with him once a month on his porch and we'd have cigars and talk. He'd tell me all these stories. And he used to always say, work should be fun, Adam. Is work fun for you? And I'd say, Ronnie, I just think that's some old Jewish man bullshit. We're just saying work's supposed to be fun because it's
Right.
work's not fun, work's work. And then I started doing what I love. I went from being a corporate executive to talking about mental health and being an advocate for something that's my calling.
Mhm.
And work for me is having a good conversation with somebody about my job. Now it's just as joyful for me as popping a cliff at Telluride with one of the kids on a blizzard day.
You're a skier, I can tell. I am definitely not a skier. I think that's true. And so if I'm listening to this and I'm thinking, "Oh, man, well, Adam and Maura have it easy because they do what they love and I don't do what I love." What's your advice? Because now you go into companies like the one you used to work at and you help them be more mentally healthy. So what do you say?
I say a couple things. One, first, it's about finding your purpose and
Yeah.
finding what you love and finding what you like to do. You know, there's a great you know, concept around wellness, right? Wellness is multidimensional, right? Wellness isn't just about your physical health, your psychological health, your emotional health, but also your occupational, intellectual, spiritual. Do you have strong relationships? And what I encourage everyone to do is call your EAP, your employee assistance program. Everyone, almost everyone in corporate America is covered by an employee assistance program. And if you're sitting there and you're going to work every day and you're like, I'm not getting the most out of my life, this work isn't fulfilling me, it's not fun, there's something you can do about it.
Mhm.
But think about it holistically. A lovely first spot is calling that employee assistance program, because your employee assistance program is not just there to help manage your emotional and psychological needs and help you get help in for your social needs, but it's also there to help with all the dimensions of your wellness. So you can talk with your employee assistance counselor about your work, and they'll help you work through what is it that about your job that you're not finding joy from. And
Yeah,
you may through that process find that it's time for you to do another job.
yeah,
It's time for you to move on.
yeah.
And I think perhaps what a message that Maura, you and I bring is that you can, you know, even as a 53-year-old dude, you can uh, quit your overpaid underwork job. Go do what you love.
Yes. I mean, I struggle because I left corporate America 19 years ago. And, it's been such a journey of I've been so lucky. I have always done work I love. I'm like the luckiest person in the world. But but the attendant anxiety and ups and downs and stressors now I'm 48, I'm like, I look at my friends in corporate America who are like, oh, I'm gonna retire in 10 years. I'm like, I'm never gonna retire. So
No,
I think
that's
the message is to find the value and purpose and the whole life fit. My friend Callie Yost always talks about work life fit. What is your fit? Not everyone is meant to do the work they love on their own. Some people find work they love in organizations. So, Adam, I want you to tell us your story. You referenced your mental illness right up top. Do you have a diagnosis? And you made it very far in corporate America. You were a CFO. You were a very senior executive. What was that journey like?
well,
Start with your diagnosis and when you got it.
yeah. So I was diagnosed with depression and anxiety. Uh, I don't remember the exact. It's non-specific
Mm-hmm.
traumatic anxiety, something like that. It's non-specific trauma based thing. I don't remember the exact title of it. But I was diagnosed 8 years ago,
Wow, not
and
long ago.
no, and it was a gift. For 20 years before that, I just pretended like there was nothing wrong with me, right? And so actually being diagnosed was one of the biggest gifts ever. I just thought that life sucked. But then what I found out once I got diagnosed was that I was been struggling with for 20 years with a clinical yet curable illness. It wasn't that my life sucked and I couldn't breathe and I was always in pain and I couldn't catch my breath and I was always yelling. It wasn't that there was I couldn't there was something clinically wrong with me that I could cure, right? And that diagnosis was just a gift for me. Um
I
now my
I
yeah,
I
go ahead.
just want to I just want to say one thing, which is, it may be hard for people who don't have mental illness to understand how you can be depressed for 20 years and think life sucks and yet live a very full life, have kids, have a great relationship, on the outside, I bet your life looked perfect.
And on the inside, one freaking Mount Vesuvius eruption of hell. So what happened to me was I could hold it in at work,
Yeah.
right? So the way my anxiety was and depression for the first before I got diagnosed,
Yeah.
the way people at work mostly experienced me is I had a presenteeism problem. Right. So, absenteeism is when you don't show up for work. Presenteeism is when you show up and you're not really there. You're just not listening. You're right. And so I got through my executive career for the first 17 years by just smiling and nodding and really not listening to anything anybody was saying. And I was really good at smiling and nodding. And I don't know what it is more, but I can pick things up really fast. And I
Yeah.
can do so. I think I probably spent, they say that on average, people who struggle with depression and anxiety, you miss like 35% of your productivity. Dude, I do not get that at all. I
Me
mean,
neither. I'm like 135% productive.
it makes no sense to me. Like on my best day as a CFO at Kaiser in the Northwest of our care system, if I had only lost 35% of my productivity, man, that would have been a great day. I
Yeah.
was just an absolute mess. So my workplace experienced me as aloof.
Mm,
In those meetings, sometimes I might ask repetitive questions and pretend like, you know, Um, on the other hand, I held it in all day. It exploded at home. It was not, I'm not married. I have an ex-wife,
mhm,
and marriage and divorce is a two-way street, right? It doesn't, it's a bilateral, two people make a relationship work and not work. But, I can't imagine what it was like to be married to me because I would hold it in all day.
mhm.
And I would get home and sometimes I could be such a son of a bitch to Sandy. I remember when I was 7 no, excuse me, when my oldest son, Herschel, was 7 or 8 years old, and I'd come home from the hospital. I think I was the CFO of our hospitals at that point, and I came home, and he said something, and I just exploded, and he looked at me, and he said, "Dad, why do you yell at us so much?" And that was like that was such a poignant moment that I didn't know what to do with then. It hurt so much and it made me worse, right? Emotionally for a while, because I hadn't been diagnosed yet. But that's how people experienced me. I could really be a aloof son of a bitch. That's it. Oh my God. That is it. You know what? I've been trying to think about how do you describe it? People experienced me as aloof son of a bitch because I was aloof because I wasn't listening, just smiling and nodding. And when I exploded, I was an SOB. I exploded at the president of our company. I exploded. Yeah, I've exploded at everybody. At one point or another, I've lost.
Was it because you were a smart, competent white man that you got away with it? Did people think, "Oh, well, he just really must know what he's doing?"
Oh, so check this out. So if you think about a lot of the behaviors, not behaviors, but the way I just described myself,
Mhm.
um, if this was like high performing executive podcast, I might have described myself like that too. Right. So, it was, from a leadership work perspective. I think it's like you find ways to fake things. Right.
Mhm.
So yeah, I learned how to say stuff like, "Hey, can you say that again? I want to. I'm not sure. I'm thinking about your question fully. Here's my favorite thing. Hey, ask me that question again. I'm not sure I heard you full, and I want to make sure I'm thinking. Dude, that thing is magic.
It's magic.
It's
People
magic. Oh,
think you're so
We'll probably use it
insightful.
on you at some point in this podcast. That was a question. Or here's the other one. Here's the best one. You ready? What do you think we should do? That's a, what do you think? Yeah. Okay. Lovely. Why? Why? Why should we do that? Yeah, okay. So easy.
What's hilarious is you've sort of just described there's this, like, multi-million copy selling book called The Coaching Habit, which is all about leaders not telling people what to do, but coaching. Those are the questions you're meant to ask. See?
One of the reasons, so people ask me, like, how the hell did you survive all those years? Right?
Yeah.
I think one of the reasons is I was blessed to go to work at Kaiser Permanente. Yeah, I haven't
Mm.
worked there for 3 years. It sounds like I mean, I've probably brought this company up 4 times in this podcast, right? I bleed blue. I still feel like I worked there because the leaders that were around when I was there, the Donna McClellans, the Cynthia Finters, the Leslie Margolins, the Artie Southam's, the David Lakes, they were naturally psychologically safe and facilitative leaders. So
Wow.
they modeled for me uh, appropriate, facilitative, and psychologically safe leadership behavior. So then I would watch how they led and mimic them. And by mimicking them, I was just leading in a calm way, but I was literally just mimicking these beautiful leaders that I had that helped guide me along the way.
That's amazing.
It is it blows my mind.
So your inner asshole was tempered.
I don't want to let these people down.
Yeah. Yeah.
And also part of it was a lot of psychological, because I lost my parents. I found my dad's suicide early in life. I found my mom, and what I missed, I look for parents. I look for adults. I look for people, for mentors, right? And so I was always, as a young leader at Kaiser, I was always, I wasn't looking to these people because I wanted leadership guidance. I was drawn and developed really strong relationships with senior leaders way above me because, and I'd be in the elevator. I'd say, "Hey, Sue, you want to go for coffee one day?" To some vice president when I was just, and she'd say, "Sure, and it wasn't because with hindsight, yeah, I was trying to grow my career and develop relationships, but I'm just looking for father figures and mother
Yeah.
figures who can take care of me. And so I think about, so like I talk about these leaders, right, that I worked with there who helped guide me for these years. And they're not just leaders for me. They were almost, they were like parents for me.
Yeah. Yeah.
I kind of like just, I have all these bunch of my parents' friends and all of these leaders at work. I just kind of adopted as being I don't have parents anymore, so these are the people, the Mark Angers, the Karen Sharpmans,
But that's a great technique. I mean, I actually I think it's a beautiful technique. My husband is very similar. My
Mhm.
husband's some of his closest friends are in their 80s and 70s, and, you know, I obviously don't wanna tell his story on air, but, I think that that's a really what psychologists would call an adaptive coping mechanism, right? Like, that's wonderful.
Yeah, I'm I have well, not just at work, but so one of the things that I did for myself was, so my dad died of suicide, and I found his suicide, right? And one of the things that I learned
When
about
you were how old?
29,
Yeah.
we were business partners, and it was just nobody knew that he was not well. No,
I remember you telling me he was sort of hail fellow well met, just
dude, he was the Rock of Gibraltar, man. No, but no, Mort Nemer was the last person anybody thought might be dealing with their mental challenges. He was just strong as a rock, calm, cool, and collected.
pillar of the community, I remember you saying,
He
sort of.
was just, he was a great friend. He would do anything for a friend. Even he would do anything for anybody. If you asked him to do something, he would just say, yeah. And my, you know, part of the tragedy of suicide, right, is you never know why.
Mhm.
Right? I mean, I'll never know the why. His his suicide for many years was, it was like this shadow that was behind me.
Yeah.
And so what I did to deal with it is I just ran really fast with a career. I just never stopped going, right? But now, uh, both his passing, it's a book. It's a picture book
Mm,
that's on the shelf
yeah.
that I own now. I'm in control of. I can take the book off the shelf and dive into and look at pictures and get emotional into and talk about him and feel his presence and all of that. But now what I can do, and this is why getting therapy is so important and getting better, is what happens now is I can close the book down, put it on the shelf. You can ask me, what was it like finding your dad? And I can walk you through it.
Mhm.
And I it emotionally brings me there.
Mhm.
And then when we're done, I close it and I put it up there and I move on with my day. That's what getting better looks like.
That's what kind of therapy helped you do that?
Oy vey.
Every
Well,
kind?
hmm?
Every kind?
It's every day I'm trying something new. You kidding me? So antidepressants. I'm a
Mhm.
lifer on those. Wait, if you ask me about that, I have a funny story for
Wait, so
that.
you were on antidepressants the whole time?
No, not at all.
Oh,
I
okay.
wish. Oh
Now
God.
you're on I get it. You're a
Could you
lifer for the rest of
imagine
your
if the
life.
stigma? Oy vey. So I take antidepressants. I started, I went to cognitive behavioral therapy. And for the first 2 or 3 years, if my pain was this, you probably can't see I'm raising my hands. If
Yeah.
if my pain was this much, right?
Yeah.
Uh, if I had 100% pain, antidepressants got rid of like 20% of it. Come down to 80%. That's pretty good, right? Maybe 30%, 70%. Then the cognitive therapy for the first couple years maybe got me down to maybe 70%. Cognitive therapy it was the best executive coaching I ever
Mhm.
got
I
because it
know.
taught me critical life skills. But for me, I couldn't breathe. I was still, I was, year and I was just, it was so important learning critical life skills, but it didn't get me. I still couldn't breathe. I basically was moving through life like I was breathing through a straw. It felt like I had emphysema. That's what this feels like for me is I can't catch my breath. And so uh, hold on one second.
Catch your breath.
Exactly.
So you just use that cup, you just grounded yourself with your
Telling
cup.
you.
It's a no, but it's great. I'm not telling you, but I'm saying for the audience. Like, I love what Adam just did because he used his cup as a way to ground him, to sort of pause, check in, right?
Dude, you totally know my trick because I wasn't thirsty. I needed to take a deep breath.
I know all the tricks, Adam. I know all the tricks.
I love it.
But it's a great trick. Like, I teach people sometimes if you're in a meeting and it's very stressful and you're getting amped up, grab your pen, your cup. And what you can do is you can practice in the off times. Like, I can use the cup and I can instantly summon the image of someone I love and my chemicals change. So anyway, sorry.
Oh, I know another
Pause.
one
Yeah.
on the exact opposite scale.
Yeah.
Someone taught me this once. One of our one of our HR leaders, Trisha Peters. Oh my god, I love her. I exploded on our Kaiser medical director. Like I'm telling you, she was our interim president in our region, and I was the head of our EMR implementation, our electronic medical
Yeah.
records. So I was called into the president's office with the head of medical director and me and my physician partner, and I was so pissed. The medical director was just asking us to do asinine. It was just absurd, and I just exploded on this dude.
Wow.
I was an ass. Okay, so this was like halfway through my career. I'm way far from being diagnosed. Trisha calls me into her office the next day. She goes calmly, says, Adam, would you stop by for a few minutes? You're president of a multi-billion dollar. I have a thought for you. I said, all right. And I knew, I'm like, oh boy.
Yeah.
So I walk up, she goes, in the most calm voice possible. She says, Adam, that was a hard meeting yesterday. And I know I'm not going to say the medical director's name. And I know it was very frustrating for you. And intellectually, you're absolutely right. But you can't explode on our medical director. Let me tell you, I have a suggestion for you. I said, what? She goes, well, when you're listening to people and you can't, you don't, you're like, you're going to explode. Put your hands, you can't see me. Put your hands on the desk like this, flat
Mhm.
down, and just listen and breathe. Put your hands on the desk and just listen and breathe through it. Now, this was years before I was diagnosed. This little thing that Trisha told, I said like these psychological safe leadership things that these
That's
guys.
amazing.
I can't wait to send her this podcast so she knows that one convert for years after. I probably spent okay, no, hold on. She taught me that maybe 7 years in. So I probably spent the next 13 years with my hands on the desk. Okay, I had my hands on the desk, breathing, smiling, not listening.
Oh my god.
Isn't that awesome?
It's such a good technique, right? Because nobody notices. It doesn't look weird. I mean, that's the thing about these grounding techniques is that they just look like normal things, like take a sip of water, put your hands on the desk.
Just a deep breath, having a 2-minute timeout, right? Standing up, walking into the other room,
Yeah,
going for a walk, excusing yourself to get a cup of water.
totally. Excusing yourself, slowing down time.
That's right. Being present. For me, I think of, for me, depression is I'm sad and worried about the past.
Mhm.
And anxiety for me is I'm, worried about the future, something in the future. And so my whole goal every day is to be present in the moment. Right.
Mm,
So that's another thing I just really think about that also helps me in those high anxious moments is
yeah,
just be here
just be here.
with the person that you're with, whether it's, more on a podcast, whether it's your buddy Bruce having a beer, whether it's, if you're waiting for the cable dude, right? Enjoy the moment, be present in that moment. And when I think about, that's actually one of the items on my list of what I need to do when I'm having a bad day is it says, am I being present? Am
Mm.
I, there's a great, one of the greatest, I joke with my kids. I'm from Portland, Oregon. So, I'm a Portland Trailblazer fan. There's this great basketball player, this guy named Bill Walton. He passed away a few years.
Oh,
Amazing felt great
he
basketball.
was a Celtic.
Dude, he was a Celtic. He became a Celtic.
You can't claim him.
Of course I can. Oh, don't get me started on this one. Anyway, so Walton, he became, an NBC and now he's like a philosopher. He's a philosophizer, right? And he has this great phrase I heard him say on David Axelrod's podcast. He goes, there, you got to learn from the past, dream of the future, but live in the present.
Ugh.
So that's
Wasn't he?
one of
He
the
was a
things on
huge
my list.
deadhead.
Huh?
He was a huge deadhead,
Oh,
wasn't
totally.
he?
Yeah.
That's well, that's awesome.
You can see it goes.
I love that.
Yeah,
Live in
yeah,
the
yeah.
past. Oh.
Yeah.
Well, I want to thank you so much. This is so great. Before we go, I would love you to say a little bit about what you offer with Simple Mental Health. The that I think you started doing when you were at Kaiser. You were the executive sponsor of a program, and you loved it so much.
Well, what happened is once I got diagnosed and uh, uh, I took about a month and a half off of work, starting antidepressants and cognitive therapy and all that good stuff. And when I came back, I just started thinking about leadership differently.
Mhm.
There's this great phrase. I mean, you've heard this, not all readers are leaders, but all leaders are readers. Right. And what that's always meant to me is that leadership it's an avocation of a journey, right? Where it's something, it's not stagnant. You're always learning things in the world and adjusting your style. And what I learned in therapy was that 1 out of 5 Americans every year experience a clinically diagnosable mental illness. Less than half get help. And the median time period from the onset of symptoms to getting help is 11 years. So now I'd been trained for 18 years as a leader in a population health organization. So I come back to work and I got like 400 or 500 people on my team, my small little team in the Northwest, like 400 or 500 people. I'm like, holy crap.
Yeah.
What if, that means I got 80 people on my team starting to be in just as much pain as I'm in. What if I had 80 people who are going to have cancer this year, or diabetes, or heart disease? We do something about it. So what we did is we piloted the mental health first aid program for Kaiser's health plan in the Northwest. And we took everyone out of work, all 400 people out of work in 4-hour increments over the course of 2 weeks, executives and staff all together. And we all learned mental health first aid. We all learned the basic facts around mental health, and we learned how to recognize if someone might be struggling and how to approach them thoughtfully and kindly. And what happened more over the next couple of years is we trained everybody, and I was open and honest as the team leader about my mental health. I'd be saying stuff like, guys, I'm having an anxiety attack. I got to go for a walk. I'll be back. Right. I wasn't doing it on purpose, but with hindsight, what was happening was that as the leader, was open and honest and sharing my story, it created the space for everyone else to talk about theirs and to start getting help for them. And a couple of years later, we had some of the highest employee engagement stats across Kaiser's Health Plan nationwide. We were the happiest team in the health plan. But not only that, on every single key customer performance measure for an operations of a health plan, the Northwest team was number 1 across the country for Kaiser.
That's amazing.
And so that was the impetus for Simple Mental Health. What I realized is, you know what? When leaders normalize the topic of mental health, when they make it normal, when they make mental health as just as okay to talk about physical health, then performance just gets unleashed, because that's what I saw happen. Performance gets unleashed, and lives get changed. And so that as a kid, I joke, I wanted to be a ski. You mentioned Bill was a deadhead. Walton was a deadhead, right? When I was a kid, I wanted to be a ski racer, follow the dead around the country, and work with my dad. That was a good life. And somehow I ended up a accidental healthcare executive, right? But once I found this became a calling for me, talking. And once I learned that by being open and by talking about my mental well-being with people, it helped them.
Yeah.
All of a sudden, I left to start Simple Mental Health. And what Simple Mental Health does is we are here for one purpose only, which is to help leaders create mental well-being cultures in their organizations. We run, half-day mental health literacy classes for boards of directors, for the C-suite, for leadership teams, and we have groups that will cascade that information and knowledge all the way through your organization. We all know CPR. Everyone has a physical first aid in their professional toolboxes. If someone was choking at a board meeting, a bunch of board members would be able to save their life. But
Yep.
if someone was having an anxiety attack at that same meeting,
Whew.
wouldn't be able to do anything, let alone even notice it. So what we do is we go into organizations and we train you, and we hardwire basic mental health literacy in your organization. So it's just hardwired, and you move on, just like your physical safety programs are.
Yep. I love it. I
I
love
love
it.
this guy in the world.
Yep. Well, yes and no, right? That's life.
No, so I mean, I say it so much, I'm the luckiest guy in the world, right? And it seems flippant almost. Especially, I mean, it's like, how can I go through so much pain in 20 years and still not, right? How can I say I'm the luckiest guy in the world? I feel that. It's getting better, right? When the amazing thing about mental illness, mental unwell being, is that when you get better, it feels so good. You think that I know that I can do anything, because man, I overcame that.
I feel the same. I think the power of I'm obsessed with mindset.
Yeah.
We don't talk about the power of mindset in managing mental illness, but I have interviewed over 1,000 people. The people who thrive are the people like you, whose mindset says, "I am the luckiest person in the world." It's not flippant. It's a mindset that is your way of believing and being in the world that creates outcomes. So, mazel tov.
Thank you. It's it's interesting. Okay. So now I have a topic for my next therapy appointment. 'Cause, who taught me this was my dad. Right. So the whole smile and be happy, really, that's what he did. Right.
Oh.
So it's like that. It's like that. It's like, and that's what I was doing before you get help. I'm going to have a lot to unpeel that onion in the next therapy session.
I'm glad
Come on, that
I'm
one anxious achiever.
glad I queued you up for that.
It's a couple copays down the drain.
I'm sorry. I'm sorry. I'm sorry, but I'm trying to give you a compliment.
You're a giver.
Oh, thank you so much.